Hey everybody, it's Dr. Daniel here, and I want to talk briefly about blood pressure and blood pressure medication. Okay, and this is something that confuses a lot of people with neuropathy, and so it's kind of a what is a double-edged sword. And we've all heard the expression, "There's no such thing as a free lunch." What's happening with blood pressures? Of course, we're doing the right thing by taking a blood pressure medication to lower it, and it makes the numbers look safer. But then that has another effect, and people don't put this together, and I don't think MDs, doctors, primary cares, physicians share this a whole lot. But your blood pressure elevation, the rise in your numbers, is a response to something else. And that response is to the stiffening or the calcification of your capillaries, of the little vessels. And so, of course, as those capillaries ice up, they freeze. Because of that, your body recognizes, hey, I have to push harder to get the blood out to the feet and sometimes to the hands. And so that, of course, is going to cause an increase in pressure. You're going to have to push harder to get the same amount of blood out to the feet. But of course, as those blood pressure numbers rise, then of course we're dealing with the issue of, hey, my numbers are too high. We want to protect the other organs, we know, brain, the strokes, kidneys, all those things, the heart itself. And then, of course, you take the medication like you're supposed to, and the blood pressure comes down. And so we're safe there. But then what happens then is, of course, we're back to the same problem. We're not getting enough blood out to the feet and specifically the nerves, those little capillaries of the feeder vessels for your nerves. And that's the paradox because neuropathy isn't just nerve damage. It's also microcirculation damage, meaning those tiny blood vessels that I just talked about, the capillaries, they're supposed to feed and nourish those nerves, and they've become compromised. So even if you have all the right nutrients, even if your gut, your gut is absorbing the food like it's supposed to, if the blood can't reach the nerves can't heal. And hopefully this makes sense. It's just not something that people really think about putting together because when somebody has neuropathy, of course, the main focus is the issue with the nerves, whether it's pain or numbness or tingling or balance issues. And so, yes, blood pressure meds can be life-saving. They protect you from strokes and heart events. So this isn't about, oh, hey, you need to stop your meds. Never do that on your own. I'm absolutely not recommending that. This is about what is happening downstream, meaning getting a better understanding of what's happening with your feet, because blood pressure is basically the push behind circulation. And if the push drops, but your vessels are already tight, stiff, inflamed, or narrowed, then the places furthest from the heart, your feet, can feel it first. And so what's going to happen is your body gets the safer number from taking the blood pressure medications, but your extremities get undersupplied in terms of blood flow. And of course, your nerves are already undernourished. And so starving even, and so they're going to stay starving, or that starvation is going to get worse. Hopefully that's making sense. That's adding up. And this is why some people do nerve treatments and maybe get a little temporary relief, but they never get the deep healing they're looking for. And because that missing piece of the puzzle is circulation. And so what we do about it is we have to focus on improving the delivery system. And that means that we have to figure out how to get those capillaries to thaw out because that's what's going to heal the nerves when those nutrient supplements arrive. That's what's actually going to lead to the healing. And so we have a very specific circulatory flow improvement protocol where we use medical grade, and this is very important, medical grade versus consumer grade, very different items. That you still can do at home. And of course, this is designed to support that microcirculation and open up the stuck flow in those extremities. And again, there are specific support strategies like nutrient supplements aimed at improving blood flow, supporting that vessel, those low capillary elasticity, and of course, helping the blood pressure helping the body regulate the blood pressure more naturally alongside your physician's plan. None of this is happens in a vacuum. We always want to look at the big picture and make everything work together. And of course, here's the issue. Neuropathy is a 24/7 problem. It's not like it takes a day off. It's always going to be going and grinding away. And so patients who have come to me in the past, hey, I did red light therapy in an office, or hey, I did infrared light therapy, but they were only treating it 2 or 3 times a week. And that's of course going to have a limited effect as compared to doing something regularly at home. And that's the reason I switched to home-based therapy because it's much more powerful. You're getting a therapeutic dose 7 times a week. Hey, if you treat twice a day, I mean that's 14 times a week. And again, more healing dose, accelerated healing response. And so, if you're sitting there thinking, okay, so maybe my issue isn't just my nerves, maybe it's that my feet aren't getting fed the nourishment they need, that they desperately need to heal. That's exactly right. Because again, at the end of the day, if the blood can't get to your nerves can't heal. And so, what you want to understand is that it's important to follow your doctor's guide, your recommendations, certainly take your medications and figure out what you can do to address the issues or side effects that go along with that. And again, hopefully that makes sense. So many patients come to me, and the first time they hear it is when we're doing our one-on-one consultation. We talk about this and a whole lot more. We get much deeper into everybody's case and situation, understanding what's happening. And of course, my focus is for patients who have diabetic neuropathy. We certainly see other patients who have neuropathy, but the vast majority of my patients do have a diabetic diagnosis or pre-diabetic. So if that's you, you have more questions, just click the link below or send us an email. I'm absolutely here to help and try and answer as many questions as possible because, again, the ultimate goal is to arm patients with education so they can understand what they need to do, what you need to do to help yourself. Because you're not the only person that's, hey, this is the first time I'm hearing it, and you're not the only person in this situation. I've helped many, many people just like you in exactly the same situation. And of course, our ultimate goal is to help as many people as possible who are dealing with neuropathy and these other issues we're talking about, blood pressure, diabetes, find a solution that's going to address all of the problems. And again, not at the symptomatic level and not just making the numbers look better on paper. Oh, my labs look great. My diabetes is controlled. It's much bigger than that. Okay. And if that answers more questions or excuse me, creates more questions than answers, I get it. But again, I'm happy to answer any questions you might have. All right. Thanks. Hope everybody has a great day. Be blessed.